Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
It is estimated that 1 in 3 adults, that's like 33% of the population, right? Mm-hmm. In the United States, doesn't get the recommended 7 or 8 hours of sleep every night. And sleep is now being recognized as a really important factor in overall health, right along with nutrition and exercise. Now, in an effort to find a quick fix for those sleepless nights, a lot of people turn to medications to help them sleep. But before you reach for the pill bottle, it might be a good idea to review your sleeping habits and work to improve your bedtime routine.
Here to discuss sleep problems is co-director of Mayo Clinic's Center for Sleep Medicine, Dr. Timothy Morgenthaler. Welcome back to the program, Dr. Morgenthaler. It's good to see you.
Well, thank you. It's good to see both of you as well.
Dr. Morgenthaler, nice to have you with us. So, there's a lot of talk now that about sleep being a good thing, but we've always sort of known that sleep was a good thing, haven't we?
Well, I thought I was listening to your introductory comments, and you actually used the words, we now recognize that sleep is an important part of health along with activity and diet. And I think that's a key thing because I think up until recently, while it was very common sense that it's important to sleep, it wasn't really recognized the significant health benefits of getting an adequate amount of sleep. And conversely, I think it's really only been in the last decade or two that we've begun to understand the adverse health consequences of getting inadequate sleep.
What has happened so that people are starting to understand that sleep is important?
Yeah, I think there have been two kind of major influences on this area. One has been if you look over the past 50 to 70 years, there's been a lot of forces that have sort of convened to devalue our sleep. And I think, like anything that once it gets under enough pressure, there's got to be a little bit of reaction. And I think as the medical community has begun seeing more and more adverse effects from inadequate sleep, interest has generated research. Research generates data. Data generates information that can then be used to guide all of us in terms of what might be really healthy.
And isn't it true that the average number of hours that we sleep has fallen over the decades? So maybe it wasn't a problem 50 years ago, and it has become a problem now.
Yeah, that most people believe that that's true, and it probably is. I'm putting a qualification on that because the fact is that there weren't very good records kept of hours of sleep. Just recently, you may have read, there was some fascinating work done by some researchers from Harvard where they went into some Aboriginal or more primitive communities that had very little contact with more developed society, and they studied their sleep patterns, and they actually found that they had relatively shorter sleep patterns, not too dissimilar to us. But, of course, there the issue is that they are sleeping in a much more primitive circumstances where maybe they have to be more concerned about their protection from animals and other things like that. So there's a lot of controversy around that, but I think in general your statement is spot on. Certainly if we looked at developed societies, since the Industrial Revolution, there's been a contraction of total hours of sleep, and a lot more problems have developed with our satisfaction with our sleep.
We talk about 7 to 8 hours of sleep a night, and we sort of tell everyone that that's how much sleep they ought to be getting. But isn't it true that there are some people who actually need less sleep and can stay healthy with less sleep?
That is true. It's probably a very significant minority of people, probably less than 5%.
Is
and
that
of course,
right?
everybody wants to be in the 5%.
Yeah, there's a lot of people who think that they're in that camp.
Yes, that's true.
That's right. I only slept 3 hours last night.
And I think that, to be fair, you have to also acknowledge that there are at least an equal number of people who need more than that to be healthy. So it's a bell-shaped curve. The 7 hours limit really has come about by a consensus conference that looked at all of the available data regarding sleep duration and adverse health consequences. And what they found was that for adults, greater than age 22 or so, that adults who sleep less than 7 hours, they have higher likelihoods of weight gain, higher risks for cardiovascular disease, diabetes, and as they get even less and less sleep, actually higher mortality. So all of the biologic and epidemiologic data begins to add up and say, for a population, the population that should aim in general for more than 7 hours of sleep in an adult. When you get to the far extremes, then the epidemiologic data starts, finding, well, maybe there's some increased mortality associated with adults who sleep more than 10 hours and 9 hours. And so, but you may be finding individuals who already have diseases that predispose longer times in bed.
All right, how about some tips to get a better night's sleep?
Yeah, so, basically, sleep comes about as a result of three interacting things. One is what we would call sleep pressure. I mean, the longer you've been awake, the longer, the more pressure there is to sleep. The second is the time of the day, and it really has to do with your biological clock. And the third is, do you have an adequate circumstance in which to sleep? And I think for most of us, where most of us are not moving around from time zone to time zone on a daily basis or anything like that. So for most of us, it comes down to managing our sleep pressures, trying to sleep at the right time of the night, and very, very importantly, what's the environment or what's the setup that we have for getting to sleep. So this really comes down to the healthy sleep habits that you mentioned before. And there's quite a number of healthy sleep habits. You can find these listed on the web at mayoclinic.org, and you can find it at sleepeducation.org. There are very many excellent lists. But in general, one of the things is that you're going to have to schedule an adequate duration to get your sleep. You cannot cram 7 hours of sleep in 5 hours, no matter how hard you try. So one of the things has to do with just looking carefully at your schedule and trying to choose, well, when is the right time to sleep? That would involve setting a bedtime that's early enough for you to get at least 7 hours of sleep. Most of us have urgent business to attend to in the morning, school, work, other things like that. It's important to keep a regular sleep schedule or a consistent sleep schedule. A small variation because, gee, it's weekend or weekday might be all right. But in general, if you're varying that more than 30 to 60 minutes, you're building in some inefficiencies in your sleep cycle. And so particularly if you're struggling to get enough sleep, that's not going to be very helpful for you. Interestingly enough, we generally require some kind of wind down time. Most of us require, particularly if we're well rested, require a healthy bedtime ritual. And so that may involve shutting down work, shutting down emails, getting rid of devices, especially that transmit light into the eyes, well before your scheduled bedtime, so that you really are setting yourself up for success. And then there's some issues related to the actual physical environment. Do you have a safe area to sleep? For many people, that's not a given, and we have to acknowledge that. Is it dark? Is it cool? It turns out we do sleep better in a slightly cooler temperature than a warm temperature. And do you have a comfortable sleeping surface and so forth? For some people, there's obviously a little bit of individual variability, but if you're sleeping on an uncomfortable surface, then you've already acknowledged part of the problem. The circadian aspects, in other words, our biological clock, we have to pay a little bit of attention to light-dark. And I think the biggest thing for us in the United States is iPhones, iPads, other electronic devices that we're bringing into the bedroom close to us at night. So those are some general things. We also know that it's probably not wise to have caffeine close to bedtime, and if you're a person who struggles with sleep, you should probably minimize your caffeine and have it very early in the day.
What about alcohol?
Yeah, alcohol is an interesting thing. Many people will talk about a nightcap or something like that, and alcohol does have an immediate sedative effect. Unfortunately, it's metabolized into substances that really fragment your sleep later. So it's a very poor sleeping aid from a sleep doctor's point of view, and it has some additional risks of possibly worsening sleep disorders like obstructive sleep apnea and things like that.
Yeah, so particularly as you get older, it seems to interfere with your sleep more than when you're a kid like you. But it's different as you get older. I would say it does truly interfere with your sleep.
Yeah.
All right, quick last question. What about sleeping pills?
In general, we would recommend that before you use a sleeping pill, that you apply some very basic, very simple techniques that go under the category of what we call cognitive behavioral therapies for insomnia. That sounds very complicated, but actually some great research has shown that this can be boiled down to 4 steps that can work for about 90% of people if they apply them. So you want me to share those with you?
You quickly.
So number 1, reduce the total amount of time spent in bed. And I know that sounds weird, but if you know that you're having difficulty sleeping, spending more time in bed actually increases your anxiety associated with being in bed. And so if you can go ahead and begin to program reducing your total time in bed so that you are not awake in bed longer than 15 or 20 minutes, that's a good start. That may increase over time. Second, get up at the same time every day. Make a pact with yourself that you will get up the same time every day, whether it's a weekday, a work day, holiday, get up at the same time every day. Number 3, don't go to bed until you feel sleepy. Don't go to bed because you think you ought to be going to bed. Wait till you're sleepy so you increase the chances that you will actually fall asleep. And number 4, don't stay in bed for longer than 15 or 20 minutes if you are not sleepy.
All right, there you go. 4 great tips. And if you want more, go to mayoclinic.org. Tell them Tracy sent you. Co-director of the Mayo Clinic Center for Sleep Medicine, Dr. Timothy Morgenthaler. Thanks so much for being with us.
Thank you.
And that's our program for this week.